With me is Dr. Mike Mullen, Assistant Professor of Neurology at the Perelman School of Medicine at the University of Pennsylvania and member of the American Academy of Neurology. Dr. Mullen is speaking to patients and caregivers today at the 2014 Brain Health Fair in Philadelphia. Thank you very much for taking time to chat with us today, Dr. Mullen.
Thank you, my pleasure.
What area of neurology do you specialize in?
So I'm a vascular neurologist who primarily sees patients with stroke, both ischemic and hemorrhagic.
Maybe just to explain to our audience the difference between ischemic and hemorrhagic stroke?
Sure. So there are two main types of strokes. About 85% of stroke is ischemic, which means that there is a blockage in one of the arteries in the brain that then goes on to cause injury to the brain tissue itself. Hemorrhagic stroke is when there's actually a rupture in one of the blood vessels in the brain, which causes bleeding into the brain, which causes damage and brain injury.
And would you share with our audience some of the highlights of your talk today for people at the Brain Health Fair?
Sure, yeah, sure. So my session was an update on stroke, and in particular, I was talking about stroke prevention. And I was really trying to emphasize four main areas. And this was, I like to think of it as stroke prevention simplified. Because I think when people think about prevention, you kind of hear lots of different things and people can get confused or overwhelmed very easily.
That's true.
And so I really want to emphasize four things. One was diet, and that diet matters. And eating a healthy diet can actually lower your risk of heart attack and stroke. And I highlighted some recent publications about the Mediterranean diet and the idea that incorporating healthy fats, fruits, vegetables, and, nuts, olive oil into your diet can lower your risk of heart attack and stroke. The second was exercise, and we talked about the importance of exercise for lowering your risk of heart attack and stroke, and I highlighted some recent evidence that supports that. And as simple as walking, and there's actually a great study published this year that showed a nice dose-response relationship. So more walking means lower risk of having a stroke.
And we could stop you there and just sort of explain to the audience a little bit about that dose response, about why neurologists, why that's an important indicator of that a treatment is effective.
Yeah. So I guess it shows that it just makes you even more confident in the results, and it shows that the more you do something, the better it is. So in this particular study, when they compared people who walked less than 3 hours a week to people who walked between 8 and 21 hours a week, there's about a 30% reduction in the risk of stroke. And people who walked more than 21 hours a week actually had about a 60% reduction.
That's quite a reduction. That's really, really exciting. I think many people, will hear from their doctors that it's important to walk. One thing I wonder is how rigorous in terms of how high should your heart rate be? I mean, to be walking in a way that is really going to reduce your risk. How do I know I'm walking at that level?
Yeah. So this particular study, it was really just about the duration. But if you look at the AHA guidelines, the guidelines are that people do 30 minutes of moderate intensity exercise 5 times a week or more. And moderate intensity for older adults is defined by the individual. So the idea is that on a 10-point scale from 0 to 10, moderate intensity, you should self-rate to somewhere about a 5 to 6. And so 5 to 6 could be very different if you're a marathon runner, right, who's 40 years old, or if you're a 70-year-old person who's really not exercising.
Right.
And so it just varies on the person. It could be as simple as just going for a walk around your community. If you're not, if you're new to exercise, if you're not very fit to begin with, that can be more than enough.
And it's good to know just the idea of a 10-point scale to know, okay, I'm putting out enough effort, whatever my sort of baseline fitness is. That I think that's helpful as a kind of guideline for people.
Yeah.
But so you had mentioned diet in the Mediterranean, Mediterranean diet, exercise, and there were 2 others that you discussed as well?
Yeah, so the 2 other things that we talked about were blood pressure control and cholesterol control. And I emphasize, it's been a big year actually for guidelines for those things. So JNC, the Joint National Committee, released their 8th series of recommendations. It's been more than a decade since they've had a recommendation. And also the American Heart Association and the American College of Cardiology released guidelines for lipid control. And I think the 2 main takeaways there, probably the most important things for community members to hear, are that these are important risk factors for stroke, and you have to be screened. Right? And you have to see your doctor to get these things checked, and then talk to them about what their correct therapy is. Particularly blood pressure for stroke. I mean, that is the #1 modifiable risk factor for stroke.
The thing is, and perhaps you can speak to this a bit, blood pressure is one of those things that can be managed.
That's right.
Right. I mean, there are good medications, and there are ways to do that.
Yeah, absolutely. I mean, so there are lots of good medications that are inexpensive, well tolerated, don't have a lot of side effects that work to lower blood pressure. And the key is the problem. I think there are two problems with blood pressure. One is that people don't feel it. So it's called the silent killer, right? And that's because they don't know it's there because they don't get checked and it doesn't cause pain.
I see.
People in the background causing problems. So that's one problem, is just knowing if you have it or don't have it. The second thing is that up to half of people who have high blood pressure don't get their blood pressure controlled. And it's probably even worse for stroke survivors. So people who've had a stroke are less likely to get their goal blood pressure than people who've had heart disease.
Why is that?
It's a little bit unclear. I think it's probably a combination of factors, but a big part of it, I think, or at least something that sort of my goal today was to try to help combat, was that people don't necessarily know their goals. So people don't know, they might know they have high blood pressure, so they get past that hurdle, but they might not know how well it should be treated, what their goal blood pressure is. So as long as people, I think, if they know what their blood pressure should be, they can advocate for themselves when they see their physicians to say, you know, I know that that's above my goal, so what can you do to help me reach my goal?
And how often should a person have their blood pressure checked? And I imagine this is the kind of thing that you know, most people, when they go for their checkup, will have done. You know, how often do you recommend that people have that kind of a check?
So it varies by the person and by their medical history. But in healthy young adults, it should be probably every 1 to 2 years. So that's probably the first barrier for people who haven't had a heart attack and stroke, is just young people tend not to go to the physician for their routine screening. So,
right.
So it's every 1 to 2 years, and it really should be a part of your regular well visits for young people who are healthy. So that the key is just making sure you're actually getting those well visits, because a lot of people, you know, they feel well, they're young, they don't have any problems, so they just don't go get checked.
Right.
And probably more often for people who have hypertension, because if their blood pressures are being managed and their medications are being adjusted, they may need more frequent checks.
I think it's helpful for us and for our readers to know that, you know, even in a healthy young person, you know, an annual checkup is a good thing. It's a good practice as a minimum. Well, thank you very much for taking the time to speak with us today, Dr. Mullen. For more information on stroke and other neurologic conditions, you can visit our website at www.neurologynow.com.